Hello everyone, now let us discuss about 2023 NM coding guidelines for telephonic services. So what are telephonic services? Telephone services are non-face-to-face evaluation and management services provided to a patient using the telephone by a physician or qualified healthcare professional who may report evaluation and management services. These codes are used to report episodes of patient care initiated by an established patient or guardian of an established patient. If the telephonic service ends with a decision to see the patient within 24 hours or next available urgent visit appointment, the code is not reported. Rather, encounter is considered as a part of pre-service work of the subsequent E&M service procedure and visit. So whenever decision is made to see the patient within 24 hours or next available urgent appointment, the code is not reported. Telephonic services are not reported. Rather, they are considered as a part of pre-service of the subsequent E&M service or a procedure or visit. So likewise, if the telephone call refers to a previous E&M service performed and is reported by that individual within the previous 7 days, either requested or unsolicited patient follow-up, or whenever the patient is in the post-operative period of a previously completed procedure. In all these cases, you should not code the telephonic services and you should consider that service as a part of the previous E&M service or procedure. So within 7 days, if some E&M service has been done, let us suppose an outpatient visit has been done on June 3rd, and within the 7-day period, if the patient again requests for a telephonic service, suppose on June 6th or 7th, that is within 7-day period, then you should not quote the telephonic services, provided they are done by the same provider for the same problem. If they are requesting a telephonic service for the same provider for the same problem, then you should not quote telephonic services if a previous E&M service has been done within the previous 7 days, or if a procedure is done within the post-operative period, if the patient is again requesting a telephonic visit, then also you should not quote the telephonic services. Do not report 99241. Do not report 99441, 99443. This series if 99421, 422 and 423. These are also other digital evaluation services we will discuss in the next session. We should not report in conjunction 99441 series and 99421, 422 and 433. Do not report 99441, 443 if 99421, 422, 433 has been reported by the same provider in the previous 7 days for the same problem. You cannot report telephonic services and other digital evaluation and management services. Those CPTs are 99421, 423. We will discuss this in the next session. You should not report these two within the 7 days for the same, if the service is provided by the same provider for the same problem. Now here you can see there are 3 CPTs in the telephonic services: 99441, 99442 and 99443. If the time duration is 5 to 10 minutes of medical discussion, you should report 99441. If the medical discussion time is 11 to 20 minutes, you should report 99442. If it is 21 minutes to 30 minutes, you need to report 99443. Here you can see the description. 99441, telephonic evaluation and management service by a physician or other qualified healthcare professional who may report E&M service provided to an established patient. They are done only to established patient, parent or guardian, not originating from a related E&M service. This service is different. It should not be originating from a related E&M service provided within the previous 7 days or leading to an E&M service or procedure within the next 24 hours or soonest available appointment, then you can, and if the medical discussion time is 5 to 10 minutes, you can code 99441. Next, if the discussion is 11 to 20 minutes, you need to code 99442. If it is 21 to 30 minutes, you need to code 99443. Let us see an example. A 55-year-old established patient requests phone visit. The patient has hypothyroidism and hypertension. Medications are reviewed and refill order is sent to the pharmacy. And the visit time, that is the time taken for the phone call, is from 6 p.m. to 6:10 p.m. So 10 minutes of time. Medical discussion. Medical discussion time is 10 minutes. So the appropriate CPT is 99441. Telephonic evaluation and management service by physician or other qualified healthcare professional, 5 to 10 minutes of medical discussion. Now let us see one more example. A 65-year-old established patient with multiple comorbidities requests phone visit. Patient has diabetes mellitus and hypertension. The patient complains of headache since 2 days and the blood pressure reading at home indicated 150 by 90 mmHg, which are uncontrolled. And the patient said he did not take his medication for the last 2 days. Reason was not specified, and the physician advised on the medication compliance and to recheck the blood pressure readings after taking medication and advised the patient to make a note for the consecutive 3 days. If still the BP is not controlled for continuously couple of days, then the physician advised the patient for an in-person office visit after 1 week. Here you can see the visit time is from 10 a.m. to 10:25 a.m. So the time, medical discussion time is 25 minutes. So the appropriate CPT is 99443. Telephone evaluation and management service by a physician or other qualified healthcare professional, 21 to 30 minutes of medical discussion. Since the time is 25 minutes, the visit time is 25 minutes, physician spent 25 minutes discussing with the patient. So the appropriate CPT is 99443. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.